Hi, I'm Dr. Rob Schroeder. I'm a clinical advisor for Air-Feed Insoles, and we'd like to talk a little bit about some of the common injuries that happen in small racket sports like racquetball and pickleball, which has become highly popular throughout North America and the world. One of the most common injuries now that we've seen, and is probably the prevalent cause of this injury in orthopedic offices, is Achilles tendon ruptures. And not just the severe injury of the tendon rupture, but also the secondary soft tissue injuries that come with that, such as Achilles tendonitis, plantar fasciitis, some of those other common things. What's happened in pickleball, where racquetball was typically a sport that was done and achieved by athletes that really knew their body and had worked out and had some level of fitness background, pickleball has become essentially a popular recreational sport. So you've got athletes that are going out there that really aren't athletes. They're weekend warriors, beer drinkers, the older people that just like to go out and have fun with their friends, which is a fantastic thing. But if you're putting yourself in harm's way, it's really a concern. So there's a few recommendations that I would give in trying to avoid these potentially serious injuries that take years potentially of rehab. Would be to, anytime you go into pickleball, because the amount of extension and lunging that the sport creates, is it puts a lot of stress on the lower extremity, especially the calf muscles and the tendons that attach the calf into the heel. So when you lunge and bend like that, that muscle has to have the ability to stretch and give when your body puts that weight-bearing load onto that. So the best way to do that is prior to any type of exercise or motion like pickleball, is to warm the soft tissues up. Simply go for a little walk or jog, or get yourself in a situation where you're creating blood flow. The second thing is to teach yourself some flexibility. Stretch those soft tissues out prior to that activity so that that muscle is ready to take on that load created by that lunge and that extension of the soft tissue. One of the things that we recommend, and the way that the insoles have been formulated with Air-Feed, is this really creates an internal prevention to injury, if you would call it, by having that air distribution through the sole. When you go to shift that weight bearing, there's a natural transition of weight bearing that takes the load off of those soft tissues. In addition to that, we talked about warming up the soft tissue. When you just naturally move with through the air foot insole, what you're going to get is you're going to get a massaging lymphatic type of stimulation, which gets blood flow moving through the area. And a tissue that has blood flow is a tissue that has heat, it has oxygenation, and is much healthier and is more resistant to injury. So those of you that have taken on pickleball, avoid the big injury. Put an Air-Feed insole in your shoe. It fits in any shoe. You can see how thin the product is. But warm up before, learn to stretch out those calf muscles, and stay out of those orthopedic offices.